another episode of MedTech Talk. I'm your host Shruti, and we have Dr. Abhay Chopada sir with us. Hello, sir.
Hi, thank you so much for inviting me.
It's great. Sir, today I want to talk about your baby, your Axonic Health Private Limited, and so let's just dive into it. The first thing I would like you to share with us is how Axonic came to be. Tell us your journey.
Absolutely. So, Axon Care is actually every doctor's dream. And it started because, despite being a doctor, I could see how healthcare delivery was still not at its best. To think about it, healthcare, even today, is not accessible to people at their point of need. We might see it from an urban perspective with a big hospital where, yes, every specialty is available. But very few people are close to a big super specialty hospital. The vast majority of the world lives in villages, lives in smaller towns where there are no specialists. And what really bothered me was the fact that if a specialist or the right person is not available, the suffering of the patient and his outcomes were very badly affected. I'll use a story, something that stuck with me since I was a young trainee in surgery. We will go back to the year 1990 when I was just in my first year residency of surgery. And we actually, as a young surgeon, there was a young 17-year-old boy who was brought by his father for tummy pain. The boy was seriously unwell. He was literally on deathbed. We as a team got very active. We gave him antibiotics, gave him fluids. His tummy was rigid. We operated on him. And on the operation, we found out that he had a perforated appendix. Condition, but it had perforated. He had got peritonitis because of that. Unfortunately, 5 6 hours after the surgery, the patient actually had a cardiac arrest and died. A 17-year-old boy died. And rather than feeling sorry and sad, I felt angry at the father. I felt the father was so neglectful that this young boy, and I literally blasted him. I am so ashamed of what I did then. But I still remember talking with the father and saying, तुमच्यामुळे तुमचा मुलगा गेला. Effectively, what it means is that you were responsible for your son's death. And the man started crying, and he literally held my feet. He touched my feet and said, Doctor, no, you at least tried, but let me tell you what happened. After sobbing for about 5 to 10 minutes, he calmed down and then he told me what the real story was. He lived in a village about 80 kilometers away from Pune. And the child, or rather this young man, complained of knee pain about 6 days prior. So he took him to the local doctor who was an herbalist. And he gave him some concoction and said, you'll be better in the next day or so. So fine, the man was okay. He had a bit of fever. No one cared anything. The next day was not better. So he took him back to the doctor and he said, see whether he's okay till tomorrow. Otherwise, take him to the city. Something that happens every day in this country. But this man had a problem that the ST ticket to Pune was about 20 rupees. So he needed about 80 rupees in total. 20 one way for both of them and 20 to get them back. And he did not have the money. So what he thought was, why don't he sell the utensils in the house? He took a copper utensil out of the house, and in order to save money, he walked to the nearby village to sell it. He sold it for 100 rupees. And again, to save money, he walked back to his village, but in the process, he lost a whole day. And this was now day three. On the fourth day, he took his son and brought him to Sassoon Hospital. And by the time he ended up with surgery, it was the end of the day. And that is how the previous 4 days had actually made the boy so unwell. Now it was my turn to go sorry. I said 80 rupees is this man's life's worth. I would have happily given him 800 rupees there and then. Someone could have made him alive. But that has been something that I've been thinking throughout my surgical. Can you not somehow solve this problem? So the concept of axon care is taking the care anywhere, anytime, in any language, was born out of something that happened in 1990. It took me time to first flourish individually, build my thoughts, build a team. But I've been trying to build this a lot earlier in different versions. Axon Care started in 2021. But like I said, I did start another startup before that, which was called Clinivantage, with the idea that we will build at least the software which will help people. And then people have been very encouraging and they said, no, don't try to just sell it. Prove that you can do it. That's what Axon Care is. Axon Care is about loving any person on the planet who doesn't matter whether he speaks the doctor's language or not. It doesn't matter whether he is in the city or whether he's in the rural area. He should get at least the right advice. I cannot promise that I'll be able to solve every medical problem. But imagine if this father knew how urgent the going to the city was. He would have borrowed money. He wouldn't have sold the utensil. He would have said, "Okay, just give me 20 rupees or 40 rupees and I'll take my son to the city and then let's first get him sorted out. Then we can pay it back." But he needed someone to tell him that. No one told him that. So that's the story of Axon Care.
Oh my God. Wow, that's deeply moving. Like it said, right? There are endless situations, but it's how you get like react to it and what you get from it and get inspired by it or just keep it in like in your mind, back of your mind somewhere. So wow, that's really amazing. That's such a tragic thing moved you so much that yeah, wow. And today Exonic is what it is. We all know that. So that's amazing. So coming to our next question, sir. Were there any turning points in the early days of Exonic that shaped its trajectory?
So, Shruti, there's not been a single day when there's been not something that we thought was pivotal. This is a very exciting journey. We keep learning, we keep feeling. What we know is that at our core, we are successful. There's not been a single hurdle as such. Like I said, I've not had any major failure. But that is only because I failed so many times before I started Axon Care that I knew where not to fail. As I told you, I've been toying with this concept throughout my adult life. And I've tried this in different versions. Still, I had the strength to put it all together and say, now I will deliver. Right? So, Axon Care is a relatively young startup. Yes, we are facing our hurdles and challenges with a great deal of excitement and enthusiasm. By God's grace, I don't think we've had any what I would consider as a major hiccup yet. So, as you had mentioned, were there any significant hurdles in our journey for Axon Care? And luckily, I can tell you that it's looking very promising. We are deploying clinics. And our concept is very simple. We are going to actually host very simple clinics where someone can walk in with any problem, anytime. And we will offer him connectivity to any doctor anywhere in the world, immediately available there. And the intervention can then be very promptly offered. As I said, the world doesn't die due to lack of care. The world dies because they don't know when to access care. And the simplest example for that would be children in Africa. You'd be surprised that even today, on an average day, 200 kids will be dead due to cholera in Africa.
That is, yeah, that's horrible. And at the same time, it makes us angry, right? We sit here in like city, urban areas, and we think that okay, because our world is okay, everything is okay. But we just need to see past what our eyes can see. Like we have to think of the whole world, and yeah, that's really great that someone like you who knows how to get around everything. And wow, okay. So coming to our next question, sir. What core values drive Exonic's mission?
I think by now you would have understood that our core value is to be able to offer care when it is needed. Our tagline more or less says it all: care anytime, anywhere, in any language. This sounds very simple, but anywhere. Imagine you're taking a flight from Mumbai to London and you fall sick while you're in flight. I'll be able to offer you care. Let's assume you're in a remote location and you're desperately looking for some medical help. I'll be able to help you. So, portability of care, accessibility of care, availability of the right advice at the right time, and of course, minimal intervention. That is what Axon Care stands for. What we don't do is trying to replicate what a doctor does. Like, we are not into anything interventional. Our core is to augment the doctor, not replace the doctor.
That's really great. Coming to our next question, sir, what exciting developments or expansions can we expect from Exonic or Exon Care?
Axon Care is on a stratospheric journey right now. So we're very, very excited because it's a first of its kind model of healthcare delivery. And it is still retaining almost everything that is done in as a part of today's healthcare, except the process is managed a lot better. So we are looking at not only deploying very aggressively in India, but we are looking at a global expansion plan. We are recruiting very aggressively. The excitement to me is the ability to augment doctors who actually are on the coal face. Actually, I'll tell you a real problem. You might think that every doctor just treats patients. He never does. I am dependent on a lot of my colleagues. Let's assume you have a heart problem and you come to me with a abdominal issue which I need to operate on. Now, I'm not worried about what I need to do. I'm worried about whether your heart will stand safe while I'm operating on you. So now I'm going to say, oh, I need a cardiology opinion. But today, what happens is that cardiology opinion means that you have to physically go to another doctor who knows nothing about what I have examined you or what I've asked you. He will start the process again. He'll ask you more or less the same questions again, but from a cardiology viewpoint. And then even he's going to say, you know what, hopefully you'll be fine. And that is because your data never went to that doctor. You just took an opinion, but he gave you an incomplete assessment. Now imagine the third person in this game is the anesthetist who's actually going to manage my patient while I'm operating. And more than the cardiologist, my anesthetist who has to be comfortable that, okay, if I see this pattern, then I can give him this drug, or I cannot give him that agent. Who's not even involved. That is today's healthcare. Even today, I'll tell you, people do get cardiac arrest on table while they're getting operated, die while they're getting operated. But what if, when I'm actually making my decision, I straight away involve my anesthetist, I get a cardiologist online, we three talk straight away, say, hey, this is the issue. It's okay, in that case, just do this, this, this. And I need an ECG, and I'll say, okay, in the next minute, I'll send you an ECG. And my anesthetist will say, but also give me an echo. I'll say, yes, in the next 2 hours, you'll have your echo. Now, what is happening is the decision making is super accelerated. But what it means is your decision point is now a lot quicker. You're not going to make patients suffer for 15 days because you're going from pillar to post, collecting one test result after the other and one opinion from another. And this becomes very, very valuable even from the second aspect is when you empower doctors, you can minimize the errors that we all make. You'd be surprised that are not error proof, though you would love them to be. And there was a seminal study done in 2000 by Atul Gawande. It's a massive, popular study. It's called To Err is Human. And the data will tell you that every 10th person who enters in a hospital is harmed by the hospital.
That is terrifying to hear. As a normal person, yeah.
That harm can happen in a lot of ways. I can give you a wrong medicine. I can do wrong surgery. I might not give you the right instructions. So it's not always harm that, let's say, kills you or maims you. The harm can just mean that I'm extending your suffering. The harm might mean that I gave you a medicine when I should have checked you for allergy. But these are all dependent on me making foolproof decisions. And I can only make foolproof decisions if I have all the data. So I'm very excited that we're building this capability for the whole healthcare sector.